Hi. Today we'll be talking about one of the new instruments that is used for biomechanical adjustments at the body level. We will talk about Sacrus. Sacrus because its beginning was designed to work in the sacrum zone. But we can now prove it is efficient in different parts of the body, specifically in the atlas vertebra, in the sacrum at the level of the dorsal spine, as well as at the diaphragm, the articulation of the knee, the shoulder blade, and the sole of the foot. What is the difference we find between Sacrus and Cordus? Well, Cordus, as we previously saw, has its action fundamentally in the deep muscles at the level of the spine, which is known and called as the intrinsic musculature. On the other hand, Sacrus, by the shape and design it has in a pyramidal way, with a tip and two sharp edges at its base, it works fundamentally with a bigger action on the muscular fascias, which is at muscular level. This guarantees position changes, biomechanical changes, fundamentally through the direct work on ligaments, on bone structures, and on the tendons. For this, we will talk about the treatment with the Sacrus in different zones. We can even, thanks to its biomechanical characteristics, we can use it combined in some cases of patients that have problems specifically in the lumbar or cervical spine. And they can be used combined for much more specific treatments, like herniated discs or specific scoliosis disorders, or pains caused by muscular spasms in this region. As we can see, Sacrus is an instrument with a tri-dimensional structure, a plane base, which is the one that is placed over the bed or the floor in case it is used in yoga, and also a face of concavity, where the therapeutic part is performed, shaped by a base on which we'll find two sharp processes that have to do with the work on the upper ligaments. In the case of the sacrum, we would be talking about the upper sacroiliac ligaments that by its disposition it will achieve a relaxation and a decrease in the toning of this zone. In its central area, besides having other sharp processes that will work on the medium ligaments
and the sacroiliac and sacroiliac ligaments,
which will also have a therapeutic action to work on them and achieve a biomechanical control of the sacrum as well. Its inferior edge is more sharp, and it has two other sharp edges that will guarantee the specific sacroiliac movements, or of those that we fundamentally united to the big articulations, like the sacroiliac articulation or the atlanto-occipital articulation. In its center, it presents a neodymium magnet, which helps to benefit the processes of the relation of the ligaments or reduce their inflammation. But that doesn't mean that the use of this therapeutic device is exclusively of magnetotherapy. Remember that these biomechanical adjuncts will perform its therapeutic effect generally by the anti-gravitational effect, which means that we position the patient on the device, and by the action of gravity and weight, the patient will progressively adjust to the device. And this will cause the therapeutic effect, changing the muscular condition as well as the ligament structure. The final objective is that it can reach as deeply as possible, and it starts to look for, in this case, problems of the sacrum, and progressively align the sacrum by the slow movements that will be produced in the ligaments and tendons. In this way, the therapeutic effect is achieved. The same happened with the atlas vertebra. It's positioned in this region, and under the gravity effect, the patient will go down slowly and progressively in a period of 3 to 4 minutes, maintaining that position, and it will cause the changes in the atlas vertebra as well. As we achieve this to sum up day by day, but mainly that the patients do it at home, it will start to correct in a progressive manner all the biomechanical postural alterations that are in the sacrum level or in the atlas.